Hi there, everyone, and welcome back to Aortic Hope's YouTube channel, AHTV, where we are sharing our live broadcast of Week in Review. And I am Molly, and I'm standing in for Karen today as she has traveled across the pond to Edinburgh, Scotland, to attend a conference with Dr. Ben Udelman, and they are going to present there with their story. And I believe she's meeting with Think Aorta UK, Think Aorta, Think Family, that organization with Gareth Owens. So anyway, we wish her well and a safe journey, and we can't wait to see what she comes back with. Anyway, I'm so glad you're here. Hi, Velda. So for those who haven't really engaged with our AHTV channel and some of Aortic Hope's productions, you can be notified of these, and by doing so, you just click on that little bell down there. It'll send you a notification for whenever there is a live event. So we really welcome you to do that so you don't miss any of our great content that we share with you. Also, please click the like to generate interest and definitely share it. Share it with your friends and family or each other in case somebody may have missed it. But sharing is a really good way to get more people involved in this community and aortic disease. So anyway, click all those buttons and sit back, relax, and enjoy our week in review. Let's start off. Okay, first of all, there's so much content. September is a big, heavy month for enlightening the community and others about aortic disease. So this is September's Aortic Disease Awareness Month, and it's the whole month of this. In addition, this week, today starts heart valve disease awareness week. And especially on Thursday, September 19th, is our very own Aortic Dissection Awareness Day. So there's a lot in this month, and it's brilliant information, and Aortic Hope has shared so much with you in addition to many live events with Ask a Doctor, Q&As, pharmacologists, really great information. And so if you've missed any of this, be sure to go to the main page, aortichope.org. It's a website, our website, and go to the events section, and you can see when everything is being scheduled. In addition, just click on that blog and you can just see everything that's been posted, and it's really great information. So here's one of them. There's an exciting announcement we have. The Marfan Foundation. We are beyond excited to announce the following joint statements from Think Aorta and the Marfan Foundation regarding the global hashtag Think Aorta campaign and the organization hashtag Think Aorta US. The Marfan's Foundation mission statement is, our mission is to save and improve lives while building community by amplifying the message to Think Aorta. When symptoms present, we will undoubtedly save more lives together. We are proud to think Aorta, but we're also proud to help Think Aorta and Think Aorta US educate more people about the signs, starting with Aortic Dissection Awareness Week 2024 and moving forward. Think Aorta is the global hashtag Think Aorta campaign welcomes the Marfan Foundation as they announce their alignment with our life-saving campaign in hashtag Aortic Dissection and commit to amplifying the hashtag Think Aorta message around the world for all patients at risk. Patients with Marfan, LOEDs, or vascular Ehlers-Danlos syndrome have a 250 times greater risk of experiencing a life-threatening aortic dissection than the general population. You can read about it below by clicking on this URL link. Aortic Hope fully supports both the Marfan Foundation and the life-saving Think Aorta campaign. This outward show of support marks a pivotal step in the Think Aorta, Think Family initiative, aiming to educate the aortic community about the critical importance of family history in understanding and managing aortic diseases. Collectively, we will amplify the key messages of the Think Aorta campaign, which stresses the urgency of recognizing the symptoms of aortic dissection, which is a potentially fatal condition if misdiagnosed or left untreated, as well as identifying those risks for aortic disease. Join us in this crucial mission to advocate, communicate, educate, and save lives. Think Aorta, think family, think community. We love that. We love the Think Aorta campaign. It has really taken off in recent years. And Gareth Owens heads that up over there in the UK. And Karen did a live interview with him earlier last week. It is fantastic. Please check that out. It's on the YouTube channel, AHTV. It's on this channel. Go check it out. Gareth Owens is an amazing man. He's also a patient, a dissection patient. Brilliant campaign, and it is spreading all around the world in many different languages and growing more and more as we speak. So here we have an article written by Adam about specialists that you may see as a patient of aortic disease. And this is from our medical student, Adam. Good morning, family. Thank you for coming back to another beautiful day of Aortic Disease Awareness Month. Today's topic is a little unique. We are going to be discussing some of the amazing specialists that help treat aortic disease: cardiothoracic surgeons, vascular surgeons, and cardiologists. While all of them work together to diagnose and repair aneurysms and dissections in the aorta, their expertise, training, and common surgeries are unique. Here we got a bunch of... Let's start with the CT surgeons, the cardiothoracic surgeons. These ladies and gentlemen are our beloved the heart surgeons, who specialize in surgical repair of diseases affecting the heart and the lungs. Ooh. CT surgeons complete medical school before starting residency. During residency, these surgeons train to learn general surgery procedures, followed by cardiothoracic surgeries, which focus specifically on surgeries of the heart and lungs. A good rule of thumb is that their main area of operation involves the chest, organs, and surrounding blood vessels. Common surgeries done by CT surgeons include coronary bypass surgery, valve repairs, heart and lung transplants, and of course, aortic aneurysms and dissections. Ooh. Now on to our amazing vascular surgeons. These ladies and gentlemen are our vessel specialists, which means their focus is treating diseases of our entire vascular system, including both arteries and veins throughout the body. This includes vessels near the stomach, in our limbs, and of course, vessels of the heart, such as the aorta. Similar to CT surgeons, vascular surgeons complete medical school and spent some time learning general surgery. However, they go on to train in vascular surgery, which emphasizes the surgical treatment of vessels throughout the entire body. A difference here between vascular surgeons and CT surgeons is that vascular surgeons may find themselves operating far away from the chest, such as in arteries in the neck, and in blood vessels from peripheral trauma, such as limb injuries, carotid artery disease, also in the neck. Ooh. Last, but certainly not least, cardiologists. These are the doctors who you will find yourself spending the most amount of time and scheduling the most appointments throughout your journey with aortic disease. Isn't that the truth? Cardiologists are medical specialists. This means they specialize in non-surgical ways of treating heart disease. They complete 4 years of medical school, followed by 3 years of internal medicine residency, where they learn about how to manage diseases of the entire body, not just the heart and the aorta. After that, cardiologists will further subspecialize by completing a 3-year cardiology fellowship, where they will become experts in the diagnosis and medical treatments of diseases of the heart and vessels. Several conditions may be managed with a cardiologist, including hypertension, coronary artery disease, peripheral vascular disease, and valve disease. Oftentimes, a patient will be seeing a cardiologist and then during a routine test, incidentally find an aortic aneurysm, for which their cardiologist will refer them to a CT or vascular surgeon. Yep, I know about that referral. After surgery, a patient will often follow lifelong with their cardiologist, who will order routine CAT scans or MRIs to follow the size of their aorta and ensure it's not growing too large again. They truly are lifelong coaches of aortic health. I like that. Together, CT, vascular, and cardiology superheroes will team up to diagnose and treat aortic dissections and aneurysms. This means that after your CT echo or MRI results come in, they may review your images together and plan the best way to repair the damage. Based on what part of your aorta has disease, one may find themselves being operated by a CT surgeon, a vascular surgeon, or both. For example, open chest surgery is usually needed if an aneurysm or dissection involves the ascending aorta. CT surgeons here will be able to open the chest safely and repair the areas of damage, taking great care to ensure the branches that come off of the aorta to feed blood to the brain remain intact. Conversely, for type B dissections involving the descending aorta, which is the area further away from your heart, or those traveling down the arteries of the leg, your iliacs, a vascular surgeon will be able to smoothly perform endovascular repair and deploy grafts to fix any leakages or aneurysms. So here we have a diagram of a type A dissection and a type B. So we have a type A. Oh, this is really, I like this diagram. Type A goes from the heart down, and the type B kind of starts after that ascending aorta, the arch. And that's all for this session, says Adam. Thanks for coming, family. I hope you learned something new today. That's all from me this week, but be sure to tune back in tomorrow for a genetics overview blog post. See you soon, family, and remember to always think aorta. Warmly, Adam. He always brings us so many great articles.
He does a really good job.
Let's take a
moment to say hi to Velda. Hi, Tom.
Hey, Tom. How are you doing up there? Both of you are up there pretty high up in our country. Oh, I'm glad you guys joined in. I hope you've been enjoying all of what Aortic Hope has been bringing this month for Aortic Disease Month. There's so much information here. And yeah, I mean, I feel like what Adam just wrote was my medical history right there. I mean, I learn something new every time I read some of these things, because really I thought a CT surgeon was something different than the vascular, and they are different, but what they actually do are really spelled out in that article. I enjoyed that a lot. So gosh, Karen has been so busy with her live interviews with some of these doctors, and they have been fantastic. This one here is Dr. Jorge Mcaro, and it was earlier last Thursday, actually. What a wonderful man. What a great interview. I thoroughly enjoyed this. He is such an accomplished surgeon, man, doctor, everything. He's just lovely. Let's read about him a little bit here, and please go back into the channel and check out this interview. It's phenomenal. It's Jorge Mcaro. He's a MD FRCS from the Medical College of Wisconsin and Froedtert Hospital, discussing many topics related to the aorta. Gosh, he's so good. He was born in Chile from Chilean parents. He was educated in Chile at the German school in Santiago and studied medicine at the Universidad de Chile Medical School, graduating with distinction in 1984. I wouldn't have thought he was, I thought he was probably a more recent graduate. Anyway, very young, handsome man. Sorry. All right. Anyway, he went on to complete a residency in general surgery, and in 1990 started residency in cardiac surgery in London. He returned to Chile in 1993, where he developed a lung and heart transplant unit. And in 2004, he was appointed as the consultant cardiac surgeon at Queen Elizabeth Hospital in Birmingham, UK. He has held leadership positions, including Director of Heart and Lung Transplant, Director of Mechanical Circulatory Support, and Head of Complex Aortic Services. Dr. Mcaro has been performing advanced cardiac procedures in lung transplantation for nearly 30 years. He serves as Director of Adult Lung Transplantation for the Froedtert and MCW Health Network. He continues to be an active athlete with achievement in competitive athletics and skiing. More recently, he has participated in competitive triathlons, including Ironman racing. Well, that makes sense. He's this super youthful and fit man. Please use the information contained in this interview as a talking point between you and your personal physician, which is another way of saying, don't you go by everything. This is all a framework of information that is supposed to start a conversation between you and your physician to get more one-on-one with your physician. I don't know, Joshua, did you happen to see this interview?
I produced this interview. I thought it was amazing.
I thought so too. I really enjoyed him.
I also agree with you. I didn't realize that he graduated when he did. I for sure thought, just like you did, that he was much younger, and being a triathlete will do that to you.
Yeah. Oh, he's just so lovely. Yeah, everyone tune into that and tune into all of them. There was another one earlier in the last week. So good. Anyway, Karen does such a great job at interviewing these doctors. I mean, she just knows just how to get in there and ask the good questions, and she's just so good at it. So it's always enjoyable. So moving on, we have genetic screening. So this was taken an excerpt from the Aortic Dissection, the patient guide, and hoping by now everyone has downloaded a copy or two and shared them with your hospital, your doctors, your cardiac rehab, nurses. It's a great guide, and I think I can venture to say that Aortic Hope is the most proud of this to date. I mean, this is just such an accomplishment and feat to get this guide out. And I thought it was just so beautifully written. And there's another one coming out, and this is also now, I believe, in Spanish. And so we're going into different languages here. And I myself have taken a copy and given it to some cardiac nurses at the hospital, and I've shared it with my surgeon and cardiologist. And I recently went to an appointment, and there was, the patient guide posters, Think Aorta, Think Family posters. It's really nice to see them kind of embracing this and participating in what I believe is just, it's just great stuff. So here, this is an excerpt about genetic screening from the Aortic Dissection Guide. It's many individuals in the community do ask the question, why do families need genetic screening? And genetic screening can seem complicated and overwhelming. Making the decision is a very personal one that should be discussed with you, your family, and your physician. Here is a brief summary from the guide. It's on page 85 and 89. And here it says, as discussed in Part A, some people have a genetic predisposition to aortic dissection, and this can therefore run in your family. If you have had a dissection at a relatively young age, typically age 60 or under, or if you have additional findings that may suggest a genetic syndrome, it's particularly important to find out if there are any genetic factors involved and whether any of your relatives may be affected. This is sometimes called genetic screening. Your hospital team or primary care can refer you for genetic counseling and consideration of genetic testing. You may need to travel. However, if there are no genetic clinics in your area, there are remote genetic counseling services available as well. During your consultation, genetic experts will discuss your aortic dissection, take a family history, and if a genetic cause is suspected, arrange for screening. The plan may involve genetic testing and or imaging, such as a CT, MRI, or echocardiogram for you and or your other family members. For those without a known aneurysm or dissection, it is important to discuss the implications of a positive genetic test or abnormal imaging test, especially as it relates to life and disability insurance. So download a guide by clicking that little button here, and it'll send you right there for you could download a copy and enjoy that. It's a great book. Great book. Oh boy, common medications for aortic disease. I'm tongue-tied today. So we have typical medications for aortic disease. Read this post for more info. This is another phenomenal interview with Dr. Kristen Watson. She's a PharmD pharmacologist, and she's so good. She just has every answer to every question you have about any medication. And I do believe she specializes in cardiology, I think, if I remember correctly. So again, it's the Aortic Disease Awareness Month, and today we want to share with you a wonderful presentation by Dr. Kristen Watson and remind you that you can view our most recent interview from September 3rd by going to the AHTV YouTube channel by clicking that link and click on the attachment below to view her easy to understand presentation on common medications for aortic disease. This includes many, if not all, of the various medications that community members are prescribed, as well as potential side effects. She really discusses the side effects, thoroughly. So she's just such a wealth of information. Yeah, I enjoyed that one very much as well. She's been on several times, Aortic Hope interviews. She's good.
Dr. Watson?
Yeah.
Yeah, she's one of my favorites. She's so cute.
She's so cute. Yeah, and I think she has a couple small kids, and she's just energetic, and she just describes, explains everything so well and so easy to understand. And it's like she's a patient herself. It's like she is. She's not, but she just understands it so well. She gets it. And, she almost knows what you're going to ask before you even ask it. Yeah, I like her. She's fun. That's a good one to tune into also. Here we go. This is a good one. So, disease terminology. There's a lot here, and it's a brilliant compilation of medical terminology that affects most aortic disease patients. And we wanted to share this with you, a glossary of terms related to aortic disease. And this was obtained from Corrigan Minam Heart Center. And I'm not going to go through these because there's quite a number of them. But let's just hit one. Let's see. Aneurysm aortic root, significant enlargement of the part of the aorta where the aortic valve sits and where the aorta meets the heart. So that's your aortic root. That's pretty. The thing about these terms is maybe you hadn't seen them before, but if you were to read through your medical history, maybe your notes pertaining to your surgery or any doctor's appointments you've had surrounding an aneurysm, a dissection, anything related to your heart disease, you're going to see some of these terminologies, if not the abbreviations. And it's a great place to, refer back and see what they're talking about if you don't understand it at the time you're reading it. And this is found in the Resource Center, the resources page on aortichope.org. And it's always good to know these words, terminology. So, you have a little street cred going into your doctor's appointment, and they know that you know what you're talking about. So it's a good stuff to read. It's really, there's so many of them. Aortic insufficiency, inappropriate leaking of the aortic valve, which allows blood that has been ejected from the heart into the aorta to leak backwards back into the heart. And let's see, let's find another one. I don't want to read that one. That looks scary. Hypothermic circulatory arrest. This is when during cardiac surgery, the body temperature is lowered significantly and the heart-lung bypass machine is turned off for a brief period to allow the surgeon to operate on complex portions of the aortic anatomy. Anyway, we go through so many of them. Pseudoaneurysms of the aorta, different syndromes, thoracoabdominal aortic aneurysms. I could go on and I won't, but that's for you to enjoy and read and kind of brush up on your terminology. It's important to know what you have, I think. So, moving on. So this we have from Duke, our other medical student.
Duke's a resident.
Duke's a resident. And we love his contributions as well. He, like Adam, just give us the information in such a way that it's so easy to read and understand. I just love this little education that we get every week from these two. He says, "Good morning, everyone. Thank you for coming back for another day of Aortic Disease Awareness Month. Today, we will be going over the 3 forms of diagnostic testing done for aortic disease. So CT scans, it gives doctors a 3D picture of your body. It's essentially having many x-rays all at once. A CT chest and abdomen. Thank you. A CT chest and abdomen, or CT aorta, allows for detailed visualization of the entire aorta from the chest down to the groin. CT scans are used to diagnose aortic dissections and to plan for aortic surgery, or as routine imaging for patients with known aortic aneurysms or other known conditions of the aorta. When patients undergo a CT scan, often a substance called contrast dye is injected into their arm while they are in the scanner, which allows for doctors to see the structure of the aorta in even greater detail. Below is a representative CT scan of an aortic dissection. And I have looked at mine so many times and I just can't make heads or tails of it. So one day I'll get it. But I do see the dissection in this one. I see the little line through the aorta. I do see that, but it's so hard to, maybe, I wish they had a 101 class of CT scan reading. I'd love to take that class. MRI scans, which are a little bit easier to go through. An MRI scan is often used as an alternative to a CT scan. MRIs also provide great visualization of the aorta to fine detail. It uses a different terminology than CT. It does not involve X-ray radiation. Undergoing an MRI usually takes longer and is quite noisy. That's the one thing, it does take a long time. MRI is not widely available in all hospitals yet and usually not employed in emergency situations. One reason why some people cannot undergo an MRI is if they have certain metals in their bodies, such as a pacemaker. An echocardiography, or an echo, uses an ultrasound to visualize the heart, its structures, measurements, and function. Echocardiography is quick and useful for assessing your heart and valves, including the aortic valve, and your ascending aorta as it leaves the heart. A transthoracic echo can be done at bedside. However, it is not a scan of your whole aorta, so for that, a CT or MRI scan is needed. Below is a depiction of an echo probe on a patient's chest, and the bottom image is a representative echo image of the aortic root and ascending aorta, denoted as ASCAO. That's ascending aorta. So we're looking at the heart, and that is, I'm just lost, but there we have it. So that's what we have today for diagnostic testing of aortic conditions. Please check out the patient guide and refer to page 49 for more comprehensive summary of today's post. And thank you for tuning in, and we hope you enjoyed our educational post. Duke. Yeah, I like those. Well, Karen was busy again on Saturday. She recorded for these guys this podcast, and it will air at a later date, and we'll let you know for sure. But it's Are You Relentless and Unstoppable? They presented Karen Anderson, and they are a team of guys for this podcast. And I'll read you a little bit about them. Doug Kenny from Are You Relentless and Unstoppable? He features Karen, the president, as you know, of Aortic Hope, and it's fitting that this interview takes place during September, which is Aortic Disease Awareness Month. Douglas Kenny and Andrew McPhee are the iconic duo for interviewing people, be it ordinary or celebrity. Having been partnered as coach, mentor, and client since late 2015, Doug and Andy are the faces of Relentless and Unstoppable. In what is very arguably the greatest comeback in history of the 21st century, Doug had a serious problem dealing with Asperger's syndrome that he overcame. His struggles in both his academics and his personal life nearly destroyed his future. Connecting with Andy McPhee transformed him. Meanwhile, Andy had a similar journey as Doug. Andy went from having severe anger problems that broke 4 relationships to being a professional actor in Hollywood. Both of their journeys brought them together in late 2015 when Doug's brother Harrison pulled out of mentorship with Andy. Since then, Doug and Andy have been formed successful YouTube channels about wrestling, racing, trains, and relentless individuals. And it's been a huge ride for both. That sounds really interesting. They sound like they came from, a difficult place in their life, and they've created this beautiful podcast that celebrates just regular people doing great things like Karen. And I think I'm really excited to see this. Again, we'll let you know what time that will be airing, and that's also on YouTube, so definitely check that out. My favorite, the Survivor Series. And wow, we have so much interest now, people wanting to share their story. And of course, we love that. So anyone who is interested in sharing their story, please contact Aortic Hope. There is a link, and just click on that, fill out the form, and we'll direct you to where you need to go. This guy, Greg Pollard, he showed up and he just said, let me do it. I want a live interview. And he did a fantastic job. This was just on Saturday. So if you haven't seen it, check it out on AHTV. What a brilliant story. What a brave guy. He presented that so well. He is just only 9 months out from his aortic dissection. And I believe you interviewed him, Joshua, and you acknowledged that he looked great. He looks healthy, strong,
Yes.
mentally. I
Yes.
know.
Not only did he look great and did he present well, but when we asked him about Pumphead, he was like, let me think about that. And so
Yeah.
there's something to be said about how old you are when this happens. He's 46, 47 years old.
Yeah.
Right. And so, I want to, other than Gabby, she's a young lady who we know of, who has a genetic disorder that is the driving force behind her multiple surgeries. But I think her first one was at 19. Right.
Oh, goodness.
And then we had, I'm drawing a blank on her name. Her and her husband were on there together. Amber. Yes.
Amber Williams.
And
Yeah.
she was, I want to say 36. Okay, so for her, another genetic component to her dissection story. But even with her, she healed very quickly, and then so now we're seeing him. He's a decade her elder. He seems to have stitched back pretty quickly. But in both of these situations, they went back to work so fast, and I think that the medical community, they're looking at age and they're like, this person's probably going to bounce back, so let's just kind of relax. Greg's doctor was like, I would have written you out of work through the summertime, right? And that just, if you're going through this and you're not sure whether or not you're ready for work, do yourself a favor, find out how far you can push the envelope to not have to go back into the office. You're asking so much of you to get back into concentrating for 40 hours a week when your body has gone to war and it has come back.
Yep.
Just be patient. I loved his interview. He's a
Yeah.
well-educated person with excellent presentation skills. He tells a very particular story.
Yes.
Very awesome.
Very helpful. I really enjoyed it. He is an educator. I believe he's a professor. He lives, I think, up near Charlotte, somewhere in North. Just check it out. It's so good. And like you said, he is on the younger side of people. He had a little bit of a history of high blood pressure since he was a young child. So he has battled this for, high blood pressure and medication for quite some time, but it still was a surprise. It happened January 3rd. And I believe he returned back to work middle of March, and that is, in my opinion, so soon. But when you're on the younger side, and I kind of was too, a little bit more on the younger side, but my job is too physically demanding. However, I think when you're on the younger side, you just you're just I can't even don't even know the words for it. It's like you're not even aware at how injured you are. Your body just goes because you're still younger and mobile and fit and everything. The older you get, the more it kind of kicks your butt and wears you down a little bit stronger. But even when you're young and you return back to work so soon after this awful event, it'll bite you because needs some needs some downtime. But anyway, he is faring so well. He's very active. Check out his story. It's wonderful. And for anyone interested, we love, love, love the live events. It's really special to do that because yeah, well, the recorded ones too, but the live events are so great because we get to see you, hear you, feel you, and also interact with you. We can type our questions and comments into the live chat and kind of, pose some questions or give him, some accolades. It's a really great experience to do a live event. So anyone considering wanting to tell their story, please fill out the form. And yeah, join us. And we'd love to share your story live, recorded, or even written if you're on the shyer side and we're not quite ready. We also do written blogs where we will share your written story. So please consider it. There's so many great stories out there that involve a thread of something that somebody else can identify with. And that's really what, the strength of this community is those common bonds that we find with each other. We're not all the same. We definitely are not even the same, but there are some common threads that do bring us close together. And that's the success of Aortic Hope right there, in my opinion. So yeah, check out that Survivor Series Saturday. We do it every Saturday. And in the weeks that we don't have a new Survivor story, we will do replay Saturdays and kind of handpick some of the older ones that have been shared over the years. And they're all so great. I think there's close to 100 of them by now. And it's in the YouTube AHTV channel. And you can go over there and check out, the Survivor stories. We love them, don't we, Joshua?
I do. I really do. I see very often that we'll get the callbacks. A lot of times it's, before the show starts or what have you. I can find out why they heard, how they heard about us, what was the instigating reason on them telling their story. And then, very rarely we get somebody who does make a callback, like Bruce O'Rourke. When his story was coming up, he made a callback right over to Chef Rob. And he was like, he was 10 months out when he told his story. And I thought, this is a good time for me to tell my story. And it just so happens that Greg was right at that same 10-month mark. And he was like, I want to tell my story. And, the closer you are to the event, the easier it is to remember. But also not so close to the event that you're consumed by it. Right. And so, we never really want to capture the story of somebody who's 6 months out. Right. Like 5 or 6 months out. You don't think that an extra 4 months is a big thing, but that recovery curve just starts ticking upward pretty drastically, and then it plateaus, and then it ticks upward, and it does a little mountain thing where it kind of goes up and down a little bit, and then it plateaus again. You have to be very patient with yourself, but those callbacks are huge, and we put it right in there. Be the shining star in somebody else's path. I love that.
Yes.
I love it.
I love how you are, you get it. You get it. You get it so well, and you haven't been through it. And I just am so impressed with how much you pick up from the community. And you just hit the nail on the head. That whole, the whole recovery process. It's cool that you pay so much attention and you really get it. You're so good, Joshua.
Yay, me.
Yay, you. So here we are. We're going to wrap it up here. Let's see. Oh, did you know pre and post-op questions? When it comes to planning a surgery, a lot of thought can go into preparing for that surgery, as well as trying to plan for the recovery. Look at these pre and post-surgical suggestions. This list just keeps growing thanks to all of you. So the community has been contributing to these. Here's a few I'll read through. When it comes to planning a surgery, a lot of thought, I already mentioned that. And we are asking you to take a look at these pre and post-surgical suggestions and feel free to add to them by commenting below. And this list, as I said, just keeps growing. For additional suggestions on these, check out the patient guide. Download a copy if you haven't done so already. And this link can be found on the website, aortichope.org, under resources and blog, both of them. So let's move on to the events. Yeah. We are wrapping up the week. We still have a few more, little bit of time left of this month. Tomorrow we have, I'm going to be doing this with you, Joshua. We have a Ask a Doctor event with Dr. Siddharth Prakash. He's a cardiologist down in Houston. He's very active with Aortic Hope, and he's just brilliant. And he will be taking questions tomorrow at 6:30 p.m. Eastern Time on Facebook. In conjunction with that, Joshua and I will be on AHTV, and we will be, kind of monitoring. What are we going to be doing? We're going to be reading some questions.
So the show's format is really kind of a 1-hour snapshot of what's happening on Facebook. And so the doctor, he's typically kind of giving us time while he's in the middle of doing other things like other reports or what have you. And he comes back to the thread and he checks for any new questions, and then he fires off an answer. And so if there's no questions, he'll be sitting there. He'll give us a good chunk of his evening, on these days. But he's not exactly at his desk the full time. And so while we are getting things prepped and questions are getting fired off, we will also be capturing any questions that you have from the YouTube channel. We will slide those into the Facebook chat for you, as well as having an anonymous questions link as well. So if you're not, if you're adverse to social media, we get it. We will have an anonymous question there. You'll be able to put your question in. We'll get that over to you. And if it's within the first hour, we'll see if we can get you a response. After that hour closes, we're going to urge you to join our Facebook group. Find that thread. It should be pinned right at the top of Aortic Hope Facebook page. And there you will see the rest of everything that's happening. In the meantime, we're going to get our darling Molly here to talk a little bit about help belts. We're going to talk a little bit about the Think Aorta campaign. We're going to talk a little bit about the patient awareness posters.
Lawrence
Hope, definitely. We want to talk a little bit about that, and probably talk more about the survivor stories, stuff like that. She's getting in there. We're gonna put Molly to work tomorrow. About an hour.
Yes.
For about an hour.
So come join us. Ask a question that you've already asked before, because maybe somebody hasn't heard that. So come join us and keep Joshua and I company for a while. It's tomorrow again at 6:30 p.m. Eastern Time. Jump on Facebook and ask Dr. Prakash all kinds of questions. So this week, Aortic Dissection Awareness Day is Thursday, the 19th, and Aortic Hangout is going on with Rob and Mindy. and there's going to be a little aortic disease and dissection celebration. And I don't know what we've decided, but if you haven't been to one of the aortic hangouts, it's at 2 p.m. Eastern time. It's a fun and casual gathering of all of the community or some of the community. They come in and out at different times. It's not, starts at one time and ends at another. It just kind of is like an open house, and it's really fun. And Rob and Mindy will moderate it, keep things a little on track and keep it going. But we just have so much fun. It's just anything goes. It's really a lot of fun. We try to make it lighthearted so that we're not always talking about our medical conditions, but we are there in case there is some questions. But I think Thursday we're going to bring. I thought I'm not sure. The idea was to bring something that is precious to your heart, something that is important to you, that is helps you maybe get through your aortic journey, your recovery. I don't know what that could be. It could be a plant that you planted. It could be your dog that you bought. It could be your little pillow. It could be a hat that someone gave. I don't know. Whatever it is, and we're just going to be there. And if you don't have anything, wear a Halloween costume. I don't know. We're just going to have fun. So show up on Thursday, the 19th, with Rob and Mindy with Aortic Hangouts. And later that evening at 8 p.m. Eastern Time, there's the Aortic Hope Caregiver Support Group meeting and celebration. And that is a private group. But for those who are caregivers, be sure and check that out. Sunday, of course, we have Kevin Songer with his Aortic Hope's Qigong, and it's every Sunday at 12:30 Eastern Time. And check that out. It's a really nice. If you haven't done Qigong, it's akin to Tai Chi, but it's a really wonderful thing to learn and enjoy. And Kevin is brilliant at it. He's a wealth of information. I mean, he really found the Zen. Right.
That's an excellent way to put that. I agree. Kevin is getting better and better at these. He's getting more comfortable on camera. The flows are just kind of appearing. It's funny. Sometimes I think he's just like making fun of me. He's like, I'm not sure what we're going to do today. And then he does like a 25-minute flow, and he's only aiming for 20 minutes because he understands that, post dissection, you only want to stress yourself so much. And so he aims for 20 minutes, but as he gets more comfortable, it just keeps going a little bit further. I was like, today was 27 minutes. He's like, oh no.
He's adorable. Yeah, he's really good. And he's learned so much. He's studied this. So it's really good. Qigong is awesome. Yeah. And then, after that, we go right into Karen's coming back. She'll be back on Monday, the 23rd, with another week in review and tons more after that. So we're glad you're tuning in here. And I hope, you're enjoying some of these programs and learning some of the terminologies and reading the articles. There's just so much here, and Aortic Hope really brings it when it comes to resources. So, yeah.
Right on. Before we go, hold on. So the Hangout situation for this week, by the way, we're trying to get a group picture of everybody that has acquired Hope swag for the music video for, What is Hope 2024, right? Mm-hmm. So the submission date for your pictures will close at the 14th. I'm sure last minutes will come in anyway. But that's going to be the last picture that we take. And also, I want to congratulate Aortic Bridge on such a great turnout this past weekend for the Aortic Bridge walk up in Brooklyn, New York.
Oh, yes. That was all those pictures shared on Facebook were so impressive. What a huge group. Dr. Ben Udelman, gathered there on that bridge on Sunday in Brooklyn. I believe our own John Brenny was there. I'm not sure. Oh, and Tim O'Reilly was there. I don't know who else. I was trying to look through the picture and see, but it's a lot of them from Maimonides, and a lot of surgeons and nurses and people, medical professionals and families. What a great group for Think Aorta.
Yeah, rock on. And John Stevens has joined our channel today, and he said hi. And I just want to make sure that he hears from us. Okay. So John says, hello, I had a type A in 2021. And he says, "Thanks for the videos. I try to watch weekly." He said, I go, "We work hard to spread the awareness. Have you thought about helping us share your story?" And he says, "I considered sharing my story over the years, but I was unconscious for several days and I've never pieced together what happened during that time. The last thing I remember, I was putting my shoes on and I did not see this line until just a second ago." He said, "At the TSA in Pittsburgh."
Mm.
Right? And so I was already responding to him not having his memory. And I go, "Those are tricky date for the day of the event, but there's still good information on your recovery, battles with post-traumatic stress, how meds affect you, all of it." He gave me the thumbs up. I threw the link in,
Oh, goody.
and he reacted to our mentioning that we, when we interview somebody who's so far out, he said, "That's a good point. I was consumed by my dissection in the first 10 months or so." Right. And that's the kind of thing that we want to make sure everybody hears. There are
Yeah.
no two dissections that are alike, but there are some commonalities in almost all of the recoveries. Okay. If you had open heart surgery, 18 months for your chest to fully repair. Right.
Mm.
And so when you hear those words and then you think about people going back to work in 4 months, Greg, you think, don't be crazy. So then he said, "My story is kind of wild. There's at least 4 of us on my mom's side of the family and possibly 6. 4
Oh.
have lived." And of course,
Mm.
I'm like, "Oh, wow, we want to collect all of those stories." He says, "No genetic component detected." And again, this goes back to our genetics talk. 70% of the genetics that we submit are variants of unknown origin or something like that. VUS, significance, various of unknown significance. And so we're still like, basically, we need to pile that data on. That's just the way to go, right? So,
Mm.
although he didn't have a genetic component detected, the thing is, his cousin might be happy to tell a story, but his aunts are a little older, maybe not so much. And either way, he said he sent the cousin the link, and we hope to hear from both of you. I
Oh,
mean, that's,
yay, John.
yeah, John, thank you so much for saying hi to us today.
John, that's awesome. We would love to hear your story. I'm with you on the type A in 2021. I was in April. So we're about the same age of event. So it would be interesting to hear your story and your cousin. Maybe we can get both of you guys on and tell your story. And yeah, and we can help piece it together for you. Can make stuff up. I hope you do join us for that. That'd be great.
Right on. Now, don't forget to tell these nice people to like and subscribe. Don't forget to share.
Of course, we need that. Like it. It shows interest. Share it. I've shared these with my family, and I was a little surprised to hear my brother and sister-in-law. They religiously watch the Survivors series. I mean, they eat it up. They just really enjoy these. But yeah, they've learned a lot through Aortic Cope and things that I've shared with them. So definitely share with your friends and family, and maybe some other friends that you've met here in the community in case they missed it. Yeah, share it and hit the notification bell. That's when you're going to be alerted to anything new live that we have coming up, and you won't miss it. So yeah, hit all 3 of them, and we're glad you're here. And Velda, Tom, John, um, yeah, thank you for coming.
And I'm going to say hi to Christina because I know she's going
Chris-
to watch this later. She watches
Oh
all of
yes.
our stuff. I love
Oh,
her.
hey, Christina. I know. Oh gosh. Well, hopefully she's enjoying the day today, and um, yeah, we'll see her next week.
All right, say goodbye.
Goodbye. Happy Monday.
And you're out.